I'm Georgia Sarquella Brugada, Head of Arrhythmia, Inherited Cardiac Diseases and Sudden Death Unit in Hospital Sant Joan de Déu Pediatric Hospital in Barcelona. Well, remote monitoring is absolutely necessary in our population. I think in everybody, but especially in children. We want to avoid unnecessary visits. We want to avoid school absenteeism and work absenteeism from the parents. So it's very important that in this case that we can offer remote monitoring to all of our patients. And of course we have a daily review on what's happening in their hearts, so we can implement the treatment they may need in any time. From my point of view, home monitoring has to have two big things, and I think in this case are the ones that we are most comfortable working with. Mainly the portability of the device, so you don't need to have your device plugged at home. You can either travel with the transmitter, and of course then you can just do an activity away from home, and you are monitored. And second of all, it's the fact of having such a good tool as Quick Check, which allows us to make a double check when the patient maybe contacts our hospital, our service, to say, I have had a problem and I want to know what has happened, and we oblige the system to do a transmission, so we receive it. Quick Check, I think it's an absolutely necessary tool which helps us a lot with our patients. All remote monitoring, wherever it comes from, either a pacemaker, a defibrillator, but also the small gadgets that we use for apps, will help us develop a more personalized, a more dedicated diagnostic and treatment for each patient. So of course, any tool that will help us in the everyday follow-up of our patients will help us implement either treatments or even no treatments for them, and with a more secure situation, they are followed and they can be easily controlled, and this is going to be our everyday life for our patients. Well, when thinking about the resources, I think most of the health systems are based on patient being in hospital, either in the outpatient clinic or in hospitalization. So when we think about how we deal with this remote monitoring, how we control these patients in their homes, and how we count them in our system, so we put some resources in order to do this work good. It's a whole change in the way of hospitals and institutions work. So it's very important that we have to implement that remote monitoring, telemedicine. It's part of everyday life, especially in an arrhythmia service, and of course we have to involve it as part of the resources. But nowadays, I don't think that hospitals are yet prepared for that, and a whole change of mind has to be placed.